Welcome to the Holistic Psychiatry Podcast. I'm Courtney Brown Snyder, a physician and holistic adult and child psychiatrist. In this episode, I'll be following up on the last two episodes where I talked about early attachment and how the first 3 years of our life impact our ability to regulate our emotions and our beliefs about ourselves and others and relationship. In the last episode, I discussed the dismissive avoidant attachment style, and in this episode, I'm going to be focusing on the ambivalent preoccupied, or what I'm going to call the anxious attachment style. While attachment in our early life experiences in the first 3 years of life can impact our emotional regulation, so can a lot of the biochemical and inflammatory conditions that I talk about here. So it's not as if it's one or the other. It can be an alignment of these factors. Some people will have more genetic loading for some of the biochemical imbalances that impact emotional dysregulation, and some people will have more experiences in their early life or lack of experiences that impacted their ability to regulate their emotions. So, as I mentioned last time, we have an attachment spectrum, and in the center of the attachment spectrum is secure attachment. At one end is dismissive and avoidant attachment, and on the other, which I'm focusing on today, is ambivalent preoccupied attachment style. And there's also a disorganized attachment style, which can have traits of dismissive avoidant or anxious ambivalent preoccupied. However, what it is marked by is disassociation and confusion. And these are situations where there would have been significant abuse in those first 3 years of life. So to just give you a short overview of what in an adult anxious, ambivalent, preoccupied attachment style looks like, this would be someone who has a strong dependence on relationship. So they can be quite needy and demanding in their relationships. They might have a lot of drama in their relationships. They might become easily overwhelmed, and any perceived loss of the relationship, they could become extremely distraught. Now, obviously, for anyone losing a relationship, that can be upsetting, but for these individuals, it's quite amplified. They are very dependent on their relationships for their sense of self-worth, and so they struggle with autonomy and feeling safe and regulated when they are alone. So the emotional state that they can struggle with is overwhelm. And again, just to compare it to dismissive avoidant attachment style, where in that case there's a lack of emotional expression, these individuals have an excessive amount of emotional expression, where the dismissive avoidant person may be somewhat avoidant or detached in their relationships. These individuals are quite needy and dependent in relationship. This anxious, ambivalent, preoccupied attachment style occurs in about 10 to 15% of individuals. In the last episode 2, I talked about the strange situation, and this was how attachment was studied in infants and toddlers, and how they use this information to predict what the attachment style would be when these infants and toddlers became adults, and also how they would parent their own children in those early years. So just to remind you, the strange situation was where the researchers had a parent, usually a mother, and the infant toddler in the same room. They might be on the floor together, playing, or just together, and a stranger, such as a therapist, would come in the room. They would leave the room. The mother would then leave the room and return. The mother would leave again, the stranger would return without the mother there, and then the mother would come back in. And what they were looking at first was how the mother engaged with the child. They were also looking at how responsive the parent was to the child with these sort of two situations of increased stress for the child. And how did the parent react to that stress? And also how did the child seek comfort, or did they seek comfort from the parent upon the parent's return? The caregiver was inconsistent, meaning at times they were sensitive to the child, and at other times they were rather neglectful. And as you could imagine, this would set an anxious state in a child because they never would quite know if their needs would be met. The children were highly anxious, and when the parent returned, they would be both clingy but also angry. And that's why you'll hear the term ambivalent, because it was this sort of, I love you, I need you, I'm angry at you. And you can sort of imagine what that might look like in an adult relationship. Just a hostility and neediness all combined. The survival belief here would be, I can't rely on my needs being met. So in the dismissive avoidant, it was, my needs will not be met. It was just, that's what it was. And in this case, it's, I can't rely on it. Sometimes they're met, sometimes they're not met, and I never know what I'm dealing with here. And that naturally would leave someone who is dependent in that early developmental stage and that early wiring of one's nervous system. It would leave them in quite an anxious and unsettled state. But what they found was, as adults, these children would have very little structure in terms of regulating their emotions. And in their relationships, they would fear loss of the relationship. And if a relationship did end, they would be extremely distraught. The other research that measures attachment that I discussed was the adult attachment interview. And this is where they talk to adults about early life experiences, not necessarily the first 3 years because people don't remember that, but just early life, childhood, family experiences of loss, abandonment, or rejection. And with the dismissive avoidant, as I mentioned, there was a narrative that things were completely fine. And with these individuals with an anxious attachment, they would often become quite overwhelmed as they were telling stories from their early life. And again, this research wasn't looking at what the stories were, like what the details of what happened were. They were looking at how the person told the story. They were looking at coherence, how they regulated their emotions. So for these individuals, they would become quite overwhelmed and sort of lacking in coherence as they told their story about their family and childhood experiences. I want to remind you again that I'm talking about extremes. We can have some of these traits and not sort of be at the very end of the spectrum. And we can all have a range of experiences in our early life that could be impacting where we fall on that spectrum. So even if you're not at the extreme end, you still might hear some things that resonate in your own life. People that might fall on the farther end of the spectrum, if they meet criteria for a psychiatric diagnosis, it could be something like borderline personality disorder or histrionic personality disorder. If someone struggles with depression, it could be marked by sadness and grief, as opposed to, as I mentioned last time, with dismissive and avoidant, the depression can look more like an apathy. Again, a lack of emotional expressiveness, whereas these individuals can have marked emotional expressiveness. So as far as treatment and tools, I would start again with emphasizing the importance of psychotherapy and really having an opportunity to be in settings where someone can learn to appropriately express their emotions and have some containment around those emotions, be in a safe setting where they're able to, in the presence of another, learn some of these tools and skills. And again, with all of the attachment areas that we think about, it comes down to emotions, emotional regulation, thoughts and beliefs. And I would add to that attention and then also behavior. In the case of emotional regulation, these individuals really need to learn how to have structure. And this structure could be in their daily life, in their weeks, and in the broader picture of their life. Because you can imagine if you struggle with fears of abandonment or fears that your partner doesn't love you, that can derail someone's work life, and can be quite preoccupying. So anywhere people can build in structure in this case, and again, this is opposite of dismissive avoidant attachment, where they might have a lot of rigidity and structure in their life, and they may need to learn to be more flexible and more expressive. These individuals can really benefit from some containment and structure. And that could be goal setting. It could be, keeping a calendar and just really trying to keep their day and routine consistent. And, what we're talking about is someone learning to provide for themselves that care and that consistency that they wouldn't have experienced in their early life. So we talk about parts work, where we have sort of our inner child, and then we also have this inner parent, and we can provide that consistency and that trust and reliability for ourselves, and that can be learned. And not just individual psychotherapy, but also in group psychotherapy. So DBT, or dialectical behavioral therapy, is especially good, I would say, for individuals who have more severe difficulties with these types of attachment issues. So I talked about emotional regulation. The other skills that can be learned are in terms of belief system. And for these individuals, if something goes awry in a relationship, they can misinterpret it and easily go to the narrative of, this person doesn't love me, this person is leaving me, and they may need to pull back and see the big picture and consider maybe something else is going on in this person's life. Maybe they don't feel particularly good today. Maybe it has nothing to do with me. So again, that would be the type of work that would be important around beliefs, and really challenging some of these automatic beliefs about what other people are thinking and what other people's intentions are. With that too can be just attention. Where do we put our attention? And for these individuals, they could hyper focus on their relationships and on over-interpreting other people's behaviors. And in terms of thought processes and attention, it can be helpful for these individuals to try to think more linearly. Again, to almost try to think like someone who's on the other end of the attachment spectrum. So where these individuals can struggle with chaos and overwhelm, they could benefit from trying to build in some linear thought processes, again, planning and problem solving, and what steps need to come next as they work through emotional dysregulation or just challenges in their life. So we've talked about feelings, thought processes, and attention, and now I'll comment on behaviors. And the most important term to use here would be boundaries. Again, we're talking about building structure. And these individuals who in early life experienced lack of care and neglect, and at other times sensitivity, they still have somewhat of a fused sense of enmeshment and lack of autonomy, as far as I'm a separate person, they're a separate person, we can connect, we can even experience intimacy, but ultimately we're separate people and responsible for ourselves. So people that don't have boundaries will be getting in other people's business. They will be trying to control others. And they will be allowing people to get into their business and allow people to control them. So learning boundaries, which if you grow up in a family where there's not healthy boundaries, and there wouldn't necessarily be with parents that are neglectful or at times rejecting or inconsistent. And again, parenting in early life is not about perfection. It's about sort of good enough and responsive enough caregiving. So these situations that I'm talking about are the result of that not being the case. It doesn't necessarily mean ill intent or meanness on a parent's part. It could be because of their own attachment experiences that left them with an inability to parent in healthy ways, but it can also be poverty, illness of the parent, of the child. Many factors can get in the way of this early development. It would be difficult to intuitively appreciate boundaries. And so that can be something that has to be learned and has to be practiced, and is very uncomfortable at first. If you've not had healthy boundaries and allowed people to get into your energetic space and done the same to others, it's going to take some work, and it takes some patience, and recognize that it's a rewiring of one's nervous system. And so you have to be gentle with yourself. It'll be uncomfortable and it'll be awkward, and it will take time. And I would add that with any attachment related issues, over time it can be important to understand how those early life experiences are shaping someone's automatic thought processes, behaviors, and emotional responses. But for someone with an anxious attachment, going there too quickly, as I mentioned with the adult attachment interviews, could lead to overwhelm. So, that can be something in a therapeutic relationship that needs to be gauged with a lot of care, as to know when it could be helpful to go there and talk about some of these things and explore some of these things, and when it's just going to be opening a box of dysregulation and emotions, and then a lot of work needs to be done to help reorganize and provide structure again for that individual. So whereas with dismissive avoidant attachment, there's a lot that needs to be done to help bring out that emotional expressiveness and awareness, these individuals again need the structure and may not be able to easily process some of that information as early on in the therapeutic relationship. Group therapy, family therapy can be helpful, but again, I wouldn't say at the expense of having individual therapy. For those in partnerships, it can be helpful if they're with someone with a secure attachment style, but that's not a treatment, and the person that's dealing with attachment issues really does need to be working through their own process in order to be able to engage in a mutually healthy relationship. I'll mention too, as I did with this dismissive avoidant attachment style, there's other tools that we use that anyone can benefit from: journaling, meditation, creative pursuits. And for these individuals who are really struggling with chaos and emotional dysregulation, journaling could become something that just starts to become triggering. But if journaling is things like gratitude lists or goal setting, or for daily goal setting, just real simple straightforward things to help people stay focused on what they want to accomplish that day, again, because these individuals struggle with derailment. Maybe doing journaling, if there was a situation, on what would be other possible narratives as to why someone may not be as friendly, or why someone might have said what they said, to just consider other possibilities. Journaling might be helpful in that way. But what's not helpful is ruminating or spending a lot of time that's just opening up again this box of dysregulation. With meditation, these individuals may find it particularly helpful to do guided meditations as opposed to meditation that had less structure and that may make people feel more anxious, just sitting with themselves and trying to be, quiet and blocking out visual input and trying to just find a centeredness. That could be quite difficult for these individuals, whereas a guided meditation will give them something to focus on. As far as arts and creativity, these individuals might consider, instead of movies and books that could be triggering, they might consider learning a new skill, something that, again, gives a structure and a direction and a way for them to build some confidence in themselves and ultimately provide themselves the consistency and the reliability and the trust that they didn't experience in their early life. And lastly, as I mentioned with dismissive and avoidant attachment style, I do see people who have strong evidence of early attachment issues. They still can benefit from having the Walsh nutrient imbalances assessed and treated if present. Things like pyrrole disorder, which can contribute to mood dysregulation, high copper, low zinc. High copper can contribute to rage and problems with emotional regulation issues. Overmethylation as opposed to undermethylation, though someone can have undermethylation and even a slow COMT or MAOA, which I've talked about here before, which can, again, give that higher neurotransmitter state. So addressing these imbalances when present can be helpful, as can addressing things like biotoxins, whether they be mold or Lyme. I just happen to see mold as being so much more common, and it can cause mast cell activation, which also can contribute indirectly to neuroinflammation, brain inflammation, which can affect emotional regulation. And I consider myself a holistic psychiatrist because I don't separate these things out completely. Rarely does someone just have one isolated thing going on. It's usually an alignment of these factors. Someone may have early attachment disruption, but do fairly well. Maybe they struggle some in their relationships, but nonetheless they might function overall pretty well. But then they could be hit with something like mold toxicity that really unmasks a lot of those early sort of default tendencies, and then really start to experience more amplified difficulties in their relationships. And so it would make sense to both address the biochemical and inflammatory and toxic elements, but then also address the impacts of the early attachment disruption and really help someone rewire their neurophysiology in a way that can have them thriving better than they were even before they became ill. I haven't spent a lot of time on the disorganized attachment, again, because it really falls on both of these ends of the spectrum. And I would say these individuals, because they are dissociating and quite confused, and this was evident even in the strange situation, these toddlers were quite confused and disorganized, and we see that in adults as well when they have triggers. It has to be addressed both in terms of their trauma, but also in terms of which end of the attachment spectrum they fall on. Therapies like EMDR, brain spotting, somatic therapies, these can all be helpful in addition for those who have had trauma. And there's other therapies as well, but those are the ones you'll hear more about. Thank you for listening. I hope you found this meaningful. I'm looking forward to interviewing Dr. William Walsh for an upcoming episode. Look out for that. If you'd like to receive these in your mailbox each week, please consider subscribing at CourtneySnyderMD.com, where I have information on my treatment practice, my non-patient phone consultations that I provide nationally and internationally, as well as my mentoring group for physicians, nurse practitioners, physician's assistants who are wanting to learn holistic approaches to treating brain-related symptoms. Until next time, take care.